Hello, my name is Julie Hebert. I'm here to go over the City of Liberty employee benefits for this new year starting October 1st, 2023. Here's my contact information if you ever need it, my email and phone number. Always feel free to reach out if I can ever be of service to you. Before we get into this cost of coverage, I wanted to let you know that we are changing providers for Blue Cross Blue Shield for our medical, and the dental, vision, and life insurance will be moving to Principal Insurance. We had a very significant 24% increase from Cigna this year based on our high claims. And so we were able to negotiate with Blue Cross Blue Shield to keep your rates the same, and in some cases even less. So that's why we've made this switch to try to keep things best for the employees and for the city. So the city does pay 100% of the employee-only coverage, and they pay 55% of all your dependents. One thing that's different this year is we do have it broken out so that you can purchase, say for yourself, you wanted to buy all of the products, medical, dental, and vision, and then you wanted to just pick up dental on your wife or husband, you could do that for $5.96 a paycheck. If you wanted to, you could do dental and vision and not pick up the medical, or of course you can still continue to cover your spouse and kids for all the products, but that is a new option that's available to you. So this is open enrollment. You do have this time to make changes for just whatever reason you want. Please know that you can cover your spouse and eligible dependents, children up to age 26. Doesn't matter if they're a student or not, and it also doesn't matter if they have access to health insurance through another employer. All open enrollment changes are effective October 1st. And if something beyond that time frame happens, like say your spouse is covered by their employment and then they lose their job, you have 30 days to let us know and we can make a change on your coverage. It's important that you let us know within that window so that we can get you added with the carrier and have everything in place. You are eligible if you have worked for the city full time. You're eligible on the first of the month following 60 days of employment. So that's good for the new folks out there. So Blue Cross Blue Shield, as I mentioned, is going to be our medical carrier. We are going with the Blue Choice PPO network, which is the largest network for Blue Cross, and you should have plenty of access to hospitals and providers without any issue. This widely accepted plan. You do have a $3,000 deductible. You have a $9,000 maximum for the family. So if I use the example of a family of five, a husband, wife, and three children, each individual has a separate $3,000 deductible bucket. But as the family unit as a whole, instead of having a $15,000 max deductible, it would be a $9,000 max deductible. So just be aware how that works. On the co-insurance, you're covered at 80% after you've met that deductible. This would apply to things like MRIs, CAT scans, surgeries, ER visits, things like that. Otherwise, you're going to be subject to the copays. So you go to the primary care physician, it's going to go to $35, and for a specialist, it's going to be $70. Please note the urgent care is $75, where the emergency room is a $500 copay. So please use that option carefully. Weigh your decision about the how extreme your emergency is and how quickly you need to access care. What level of access you need also is important here. So be sure you keep that in mind when you're seeking that type of care. On the pharmacy coverage, you will want to use a preferred pharmacy, which would be Walgreens, Walmart, Albertsons, Express Scripts. Those are all going to give you a lower copay. You can utilize like CVS, but it is considered a non-preferred pharmacy and would be charged, say, at this non-preferred rate. So giving the example, if you had a generic prescription, you took that prescription to Walmart, it would be a $0 copay. If you took that same generic prescription to CVS, it would cost $10. So just be aware of that when you go to fill your prescriptions starting 10/1. This is giving you some information on the provider network. Be sure that you stay in network whenever possible. You're always going to receive better benefits. This is talking about the preferred pharmacy being Walgreens, HEB, Walmart, Albertsons, and CVS is not a preferred in-network provider for Blue Cross. You can use Express Scripts for longer term prescriptions like 90 days. So things like cholesterol medicine, blood pressure, things you take on a routine basis. You might want to look into doing that at a lower cost. Encourage you to go online with Blue Cross Blue Shield, and after October 1st, you will be able to access your digital ID card, explanation of benefits. It's a great place to look for providers. You can search by name, you can search by specialty, zip code, all kinds of different options to search and filter there. You can also look at reviews of providers there, and you can look for kind of the low cost savings using the medication finder tool. There's a lot of information out there on the Blue Cross Blue Shield website. There's also an app, of course, and so here's information on how to download the app so you have everything at your phone and at your fingertips. There are also a lot of other benefits available to you through Blue Cross, like you can use the service of MD Live, where you can talk to a doctor virtually if you want to do that and not have to go into a doctor's office. There's information on how to do that. There's also a 24/7 nurse line, and the number for that will be on the back of your Blue Cross ID card. The Blue 365 fitness discounts, there's some information there, and that's helpful. And the Well on Target wellness tools, there's some benefits and rewards available to you in that app. Also some weight loss assistance, health and wellness information. Then Catapult Health is a virtual checkup. So you can use this if you want to just do kind of a preventative checkup virtually rather than having to go into the doctor's office. There's also a lot of information in the employee assistance program. So the guidanceresources.com is there. The dental insurance, the dental, vision, and life insurance are all moving to Principal. So that's going to be also a new change for you. So the Principal network is, again, very wide network. You can go and get your teeth cleaned once a year at no cost to you. If you do have to have a filling or something done while you're there, you're going to have a $50 deductible. And then they're going to pay at 80% and you're going to pay at 20%. If it's something like an oral surgery or a crown, they're going to pay 50%, you pay 50%. It is a $2,000 maximum for the year, and you do have orthodontia benefits for children in this plan. So those are all great benefits and staying the same as what we had with Cigna, just a different carrier. Here's information on how to find a dentist. We encourage you, of course, to stay in network whenever possible. There's the website for the dentist or the 800 number. The vision benefits are through Principal. They utilize the VSP network, which is the largest vision network in the United States. So that's great. The information on how to find a doctor is there, the 800 number. Again, you can go and get your eyes checked for $10. So that's a low cost eye exam. Then you can get new glasses. You can get new frames every other year, new lenses every year. There's a $10 copay for the lens. You have a $150 frame allowance for your frames, and anything you spend above that $150, you're going to receive a 20% discount. If you do want to get contacts instead, you have $150 towards contact lenses. The City of Liberty does provide a life insurance policy for you that's 2 times your annual salary, which is a very nice benefit. It also includes accidental death and dismemberment coverage. It does reduce as you age, so pay attention to that. We want to make sure your beneficiaries are correct. You'll update that as you go through EASE this year. If you do end up retiring with the City of Liberty, they offer a $5,000 life insurance policy that stays with you that they pay for. They also provide dependent life insurance that's $5,000 for your spouse and $2,000 for each child, that's free. So it's important that we have the information about your dependents. So when you're going through EASE, make sure that those dependents are there so that we can cover them under that policy. There's some new benefits that are going to be available to you this year through Principal. There's a voluntary life insurance that they're offering, so you can purchase additional life insurance. So say you have 2 times your salary, that puts you at $100,000 of coverage, but you really wish you had about $300,000. So you could add an additional $200,000 with Principal this year. Without any medical questions, you can apply for $150,000 for yourself. You can apply for $30,000 for your spouse. But the most you can do for yourself is $300,000 and then $100,000 for your spouse. Children can also be covered at $10,000 of coverage. and it is relatively inexpensive. So I encourage you to look at this and check that out because that is new. And this is the first time we're offering it. So you have that ability to just get 150,000 on yourself without any medical questions, 30,000 on your kids without any medical questions, and 10,000 on your children without any medical questions. So it's a great year to try to pick that up if you've been interested in that. Critical illness insurance is basically if you become ill, it provides you with a lump sum cash payment that's paid directly to you. It helps alleviate financial worries during a serious illness. There's some more information further in the handout, so we'll talk about that. Um, Accident insurance covers you in a similar situation. It's going to make a lump sum cash payment again to you or to any of your covered members if that comes up and you have an injury. So we'll talk about that a little bit. Again, another time where you might need some extra cash on hand is if someone, you or your loved ones, are hospitalized. This makes a covered payment to you for being hospitalized with additional payments for coverage like ICU and things like that. So we'll go over some more details of that in just a moment. This is giving you information about COBRA. So if you do leave the City of Liberty, what it would cost to continue your coverage. This is information about Medicare. If you turn 65 and have any questions about this, be happy to help you with that and talk with you over it. It's a pretty complicated experience to go through becoming eligible for Medicare. So be happy to help you with that. Here's some information on how to get signed up for Blue Access for members. As I mentioned earlier, here you can scan this QR code and get signed up. It's very simple and easy to use. This gives you some information about where to find things, how to find what you've spent, how to find a doctor's office and wellness information. There's just a lot of information out there. Just on your quick dashboard, it'll show you what your deductible and out-of-pockets are. So there's a lot out there for you if you're needing any of that information. This gives you information again about the app. See, it's a nice, clear thing right there on your phone you can look at. So that's great. And of course, Principal wants you to do the same thing. They want you to log in, create an account, and access all the information for Principal for your dental, vision, and life insurance. All that's right there on how to do that. So here's some additional information on the voluntary life insurance. Since this is new, we wanted to give you a little bit more detail on that. So as an employee, you can purchase, like I said, $150,000 with no medical questions. You can go up to $300,000, but you will be asked to answer some medical questions, make sure you qualify. On your spouse, you can do $30,000 without any medical questions. You can go up to $100,000 if you're willing to answer some of those. And then, like I said, for the children, it's $10,000 of coverage. So this is giving you additional information on the accidental death and dismemberment and what those payments would be. And remember, if you were to pass away in an accident, your coverage is basically doubled. So if you purchased the extra $150,000 and you passed away in a car wreck, it would actually be a $300,000 death benefit. The critical illness just helps cover expenses when you're diagnosed with a critical illness and going through those types of experiences where you're having a lot of out-of-pocket medical costs, missing work, things like that. So this is just going to be a direct cash payment to you or for your dependents. You choose the amount that you want to cover. You put in the amount that you want to cover and your age, and that's going to give you the price. And based on the amount of coverage you want, also bases your payment. So if you pick a $50,000 coverage and then you are later diagnosed, say, with a brain tumor, you would receive a $50,000 payment. In the case of like coronary artery disease, you would receive 25% of that. So this is the list of illnesses that are covered and the amount that would be paid for those illnesses. So that's pretty extensive. There's a lot of information there. Important to note that they do have a health screening benefit. So you can get an extra $50 back if you do the health screening benefit, which is a great thing to do anyway. If you leave the city, you can take this coverage with you. So that's a nice benefit. There's some information there about if you have already been diagnosed with an illness, if you haven't been treated in the last 6 months prior to the coverage, then you, that is not considered a pre-existing condition. So if you had cancer 2 years ago, you could still take this policy out. And if it has a reoccurrence, you would still be covered. So this is some information about the accident policy. So basically, this would have to be a non-work accident, first of all. So anything that happens at work would be covered by workers' comp and not by the accident policy. So this is, think about you're, out in the backyard working and you cut a finger or you hit your head or you're in a car accident. These are things when you're on your personal time that might happen to you or your spouse or your children. You can cover everyone. Talking about a burn. So let's just give the example of you have a broken, fracture. You have, maybe you're in a car wreck and you have a fracture in your skull. It would pay $10,000. If it's something like, say, a knee injury, $1,500. A dental injury is $500. So it's a certain accident happens, again, off the job accident, this is going to be your payment. That's kind of how those work. It does also provide an accidental death and dismemberment provision. And so it does have a death benefit. Basically, if you were to die in an accident, it would pay an additional $25,000 to you if this accident policy was in place at the time of an accidental death. Talks about loss of like a limb, a finger, a thumb, things like that. Talking about paralysis, loss of speech and hearing and things like that. Again, this does have another $50 wellness benefit, so you can get that done and receive that benefit as well on this. So some information there on that. Then the last option that you'll have to purchase is on a hospital indemnity policy. So basically this says that if you go into the hospital, say you're sick and you have to go in the hospital and spend the night, your first day, you're going to receive $1,000 payment. Any day after that, you're going to receive $100 up to 30 days. And then ICU payments would be $200 for 30 days. And it does also include newborns coverage. So this talks about who can be covered. This talks about pre-existing conditions, talks about pregnancy, all of those things. Again, this does have a health benefit as well. So if you go get that health screening, again, you could receive a $50 benefit, and it is portable. You could take it with you when you leave. So here's some other discounts that are available to you just because you're a City of Liberty employee. You don't have to buy any of this other stuff. Just being a City of Liberty employee, if you decline everything, you're still eligible for these assistance programs just because you're a city employee. So they do have will document center. They can help you prepare a will. They have an identity theft kit. They have beneficiary support. If something happens to you, then they can help you with that. They do have an emotional support line, teeth whitening. There's all kinds of great information there for you. And then I just want to show you this on Ease. We're going to continue using that as our enrollment platform. One thing that's new this year is if you don't remember your password, you can recover that by using your mobile number. So when you go on to the website, to the link that'll come to you in email, you can click on login with mobile phone right here, and that will take you to this screen. And you type in your mobile number, and it's going to send you a text code. That text code, then they'll ask you for the last 4 digits of your social, your date of birth, or some identifying factor. And then you'll be asked to reset your password. So you don't have to wait for me to reset your password or try to remember what it was. You can recover it with just your mobile phone this year. And also, when you do reset your password, please be sure to know that they require an uppercase, lowercase, number, and special character. So it's kind of one of those complicated passwords to try to set up, but just that keeps your identity safe. So that's all your benefits in a nutshell. I appreciate your time. If you ever have any questions, please feel free to reach out to me, and I can help you with any questions that you have. Thanks so much.